The program is actually very comprehensive. The first 2 years are done at the University of Florida in pediatrics, and then you do pediatric neurology at Nemours Children's Health. And then the pediatric neurology program has a relationship with Mayo Clinic, Florida, which again has 3 campuses, and you would be exposed to learning materials across all these campuses. Now, the uniqueness of this setup is that you actually have a small program in pediatric neurology that's embedded in a system that is very large, both in pediatrics and in neurology. Pediatrics being in Nemours Children's Health and neurology being at the Mayo Clinic, Florida.
I like to tell my friends that this program has a great mix of several organizations working together in the best way possible. It always amazed me that you have University of Florida, you have Nemours Health, and you have Mayo Clinic, these 3 very large organizations that are doing great things that work together almost seamlessly.
In the Jacksonville area, all pediatric care is really delivered at Wolfson Children's Hospital, all tertiary care. Wolfson Children's Hospital is a large tertiary care children's hospital with a level 1 trauma center, and it has, as of 2022, the only neurocritical care unit, that means the pediatric neurocritical care unit in the state of Florida. So you would easily be able to see a large number of patients and with a variety of conditions, because all the patients, since this is a tertiary hospital, all the patients would be referred in here from the surrounding area. So the catchment area is estimated to be about 3 million people, and there's one children's hospital that services that catchment area, and they all come right here for their pediatric care.
Nemours Jacksonville was not somewhere where I had envisioned going, but when I was searching for residencies and fellowships, I was really looking for the program that would leave me being the strongest trained fellow I can be. And when I came here, I found a combination of people that were really kind to work with, really good autonomy for residents and fellows, and access to a patient population that, frankly, I couldn't find anywhere else in the country. And so that was highly appealing for me to come here.
Once you go on to pediatric neurology, you're going to be exposed to a whole variety of specialties. So if you have a neuromuscular condition, spinal muscular atrophy, one of our faculty members runs a specialty clinic for that. If you have a stroke, our stroke program is very comprehensive. Epilepsy surgery, brain tumors, neuromuscular problems, or autoimmune problems like multiple sclerosis. We will have faculty that are specialists in multiple sclerosis, in evaluating and treating autoimmune encephalitis. Many neuroimmune problems would also fall under that spectrum. So we have a very wide range of areas that you could learn right here, and it's very comprehensive. It covers pretty much all the areas that you're likely to see in your career. But they would also include a lot of common conditions, obviously, and you would be very much involved in learning how to evaluate those patients and how to manage them, how to treat them appropriately with the cutting edge types of treatments and technologies that are available as well.
When I talk to my medical school friends, I tell them that the training here is excellent. I tell them about the catchment area, the diverse patients that we see, and the ability to have graduated autonomy and to really come into your own as eventually progressing to an attending physician. I also tell them about, kind of the people that we work with and how nice they are and how we have fun at the hospital. And so it's a really good experience.
We've sort of recreated the educational space, and what we've done is created an open format lobby system where you're actually able to interact with your colleagues and have a coffee together and talk about complex problems together, even though they may not be in neurology, but they would be in other specialties that can teach and enlighten clinical discussions and outcomes. This is more like a lounge, so you can actually, there's casual chairs to sit back on. It's not an office cubicle space only. It's a very interactive space that we've recreated, all brand new for 2022.
So I would say the culture in this program is one that fits with the Southern hospitality vibe. But at the same time, we get things done. So I think everybody works together to be efficient and to work cohesively to make it a good learning environment and an environment where we focus on patient safety especially.
The culture is really nice, and I think it all stems from the people that are here. I think the culture of a residency program is reflective of the department that has been here. And when you look at Nemours Children's Health Jacksonville, our faculty really hasn't changed in the last 8 to 10 years. The people that are here have stayed here, and we've only added. And so there's something about this program and these faculty members that is appealing. They're enjoyable to work with. They are excellent mentors. They are experts in their field. And at the end of the day, they're kind of like family members, and you can go to them for all sorts of issues.
You have to remember that in pediatric neurology, you're learning 3 disciplines. You're learning pediatrics, adult neurology, and pediatric neurology. So the educational component is huge, but added to that, an important piece is the research portion. And the research portion is mentored and it's structured. We actually have electives that are research electives in which you could learn methodology for it. So if you're looking at study design, learning biostatistics, all of those aspects are in modules that can easily be incorporated. We encourage that. We want you, even if your career is not one of a research focus, we want you to understand research methods and research weaknesses as well.
I think this program has made me a better physician, number one, which is ultimately what you need. It's given me autonomy to gradually make my own decisions, gradually become accustomed to, helping patients. And then it's made me a better leader as well. We're somewhat of a medium-sized program, and so we're now 2 residents per year. But when you're only 1 or 2 residents per year, you have a lot of people rely on you, and so the patients rely on you, and you really have that connectedness to the patient population, which helps you grow.
And your future plans could be in clinical practice, or it could be in academics, or it could be in hardcore research. And we mentor our residents in each of those areas to achieve those goals.
My passion is pediatric epilepsy, so I ended up doing some bigger projects with some of the epileptologists on the Mayo side, but also working with some of the experts that we have here on the pediatric epilepsy side, like Dr. Sheth and Dr. Galan. I found that if I want to work on a research project, there is someone who's ready and willing to work with me on it and mentor me through the process.
Research is integral, I think, in any pediatric specialty. We need to advance medicine, and part of that is participating in research. And that has been something that Nemours has really supported us in doing. And so I know a few of my other trainee co-residents that I work with have pursued research projects, and I've pursued research projects myself. Just going through the IRB approval process with Nemours and having access to patients, those can be hard tasks to accomplish, especially when you're in the hospital and working the hours that residency demands. But the support staff has been phenomenal, and so it's made it tremendously easier.
I think we have a holistic view of education and development. So we want people to learn the hardcore material. We want them to be able to feel comfortable making judgment decisions about conditions, but we also want them to have a healthy work-life balance. And we have a very active wellness program. It's a very nurturing program for the whole person and your whole development, not just your educational development.
Residency is tough, and it's tough for a reason, and that's that at the end of our training, we're going to be holding the lives of children and their well-being in our hands. So I think our residency is appropriately busy, but we do get a work-life balance that I've really appreciated. Yeah, I think there are a lot of things to do in Jacksonville. Food is one of my passions. I love to eat, and there are so many restaurants that plenty that I haven't tried in the 5 years that I've been here. There's lovely beaches that I didn't have when I grew up in Dallas, and we love to. My wife and I love to hike, so we do a lot of that, not only within the Jacksonville area, but hour or two drive north or south, we go to some great hiking places.
So I became kind of a hobby golfer being here. There's a lot of outdoor space, which is really nice. The weather is great here. It's normally 60 or 70 even in the coldest months, and so that's a really nice break from being in the hospital. I also had my first child here, so his birth home is always going to be Jacksonville, Florida, so Jacksonville holds this very dear place in my heart. I'm pursuing a career in epilepsy surgery. After my residency here at Nemours, I'm going to be doing an epilepsy fellowship at University of Chicago, and I feel like the faculty members here have really fostered my growth and helped me achieve that goal, which I'm very thankful for.
So my next step in my career is I'll be doing a pediatric epilepsy fellowship at Stanford. So I will be working on something that I feel very passionate about, and I think that passion has really developed through my residency program here, my time in this residency program. So I think I absolutely have gotten what I need and want out of this program, more so than I expected probably on day one, and never looked back.
This is a two-way street, so really when I look at residents, I'm looking at the enthusiasm they bring into the program. I love being around residents and med students because they're always asking interesting questions that make you think. I've done this for a long time, and you think you've figured the whole thing out, and yet they bring that question to you that makes you kind of go back and question some of the things you have been teaching in many ways. But what we're really I'm looking for personally, is a person that's very enthusiastic about learning and very curious in terms of their approach to neurology and pediatric neurology. I'm very proud of our residency program. It's come a long, long way. It's a preeminent program. Yes, we are competitive. Yes, we get a lot of very qualified applicants, and we're very happy for that. But the thing that makes me the most proud is to see that transformation of a resident that comes right out of med school into the first 2 years of pediatrics, and over that 5-year period they spend with us, where they're transformed into young faculty doctors, into young pediatric neurology specialists that are going to impact the lives of children for decades to come. And that makes me very, very happy about the way our program's developed.